Yes, hello. Welcome, everyone. We're so happy to have you here today for our Lunch and Learn. So I'm Kathy Marcello, she, her. I'm the interim executive director at Modern Military. And we've got Dr. Mary Brinkmeyer here today, and Ilaria and Antonique from Modern Military. And we are really excited to talk to you about how to navigate the VA in some of these challenging times for our unique circumstances. So Modern Military is a nonprofit that's been around for almost 30 years. We advocate for LGBTQ plus service members, veterans, and their families.
So, hi everybody, welcome. I'm Mary Brinkmeyer, she, her. Just a little bit about me. I worked for the Department of Defense for the Navy from 2008 to 2022, and I was on the Naval Medicine East Transgender Care Team from 2016 to 2022. And provided care to a lot of LGBTQ and service members during that time. And then I transitioned to being the LGBTQ plus veteran care coordinator at the Hampton, Virginia VA Medical Center. And this February, with everything that was happening, I ended up leaving the VA, and I'm currently in private practice. So I'm going to be just talking about, to start with, a little bit of the history of LGBTQ plus service, just briefly, because I imagine that most participants here are aware of that, but also specifically looking at what has changed at the VA and what things are still the same, and then talking about how you can advocate for your care as an LGBTQ plus service member.
I am Antonique Jones. I am the mental health specialist for Modern Military. I primarily run the Resilient Heroes program, which I will tell you about a little later. It's a great program that we have for the community. I am a Air Force veteran of 10 years. I work within mental health. I'm a licensed clinical mental health specialist. And I'm excited to be here today. So a little bit about me.
Hi, my name is Ilaria, and hoping the video pops up. But I've been with Modern Military now for maybe 5, 6 years, and I am a transgender veteran retiree from the Army and have been very active in this space, and I'm happy to be here today.
And I'm thrilled to be asked by Modern Military to be here and to be presenting with our other presenters as well. So as folks here probably know, there were outright bans on service by lesbian, gay, bisexual service members that were in place until 2011, and then bans on openly serving transgender service members in place until 2016, which is when transgender service members began being permitted to transition, both in terms of their gender marker and treatment and social transition within the service, as well as medical transition. As we may remember, in 2019, 2018, there were some very abrupt tweets about the end of trans service, but then the partial ban was not put in place until April of 2019. And transgender service members who had already received a diagnosis of gender dysphoria and had already begun treatment were allowed to remain in. And then, as we know, there was a harsher ban that was put in place in 2025. And yeah, unfortunately, since I made this slide, that the legal challenges, while they're still ongoing, the Supreme Court is allowing that ban to go forward. What we know about health disparities for our LGBTQ plus veterans is that our veterans who belong to LGBTQ plus communities tend to have higher rates of military sexual trauma, in many cases being targeted specifically because of their sexual orientation or gender identity, as well as higher rates of post-traumatic stress disorder, depression, and substance abuse. Also knowing that when we look at post-traumatic stress disorder, many veterans are experiencing post-traumatic stress not only from traumas such as sexual assault or combat, et cetera, but from having to serve in secret, being afraid of being found out and removed from service or being removed from service. And we know that the population has a higher suicide risk, so more in need of outreach and preventative care in that regard than veterans as a whole. And then also that there are some physical health disparities. So for example, things like higher rates of pain, higher rates of high blood pressure, et cetera. And as I said, especially trauma related to concealing identities. So minority stress, meaning that the person has experienced discrimination or harassment, feels compelled to hide their identity, and also may have internalized homophobic or transphobic thoughts about themselves. And because of this minority stress, LGBTQ plus veterans have been seen as needing extra support while accessing VA care. So needing extra support to feel that the VA is a welcoming and safe place for them, and needing to have also safe people within the VA identified who they can go to to coordinate their care and to provide support in the event that they experience negative experiences with VA or VA providers. So because of that, the LGBTQ plus health program was founded in 2012, which was a multifaceted program looking at all aspects of mental and physical health for our LGBTQ plus veterans, and doing a number of outreaches, research projects, et cetera. In 2016, LGBTQ plus veteran care coordinators were added at every VA hospital in the nation. And then in 2022, the VA began collecting information on sexual orientation and gender identity to better inform care. So looking at what do we know about our LGBTQ plus veterans in terms of health outcomes and health disparities. And so with the LGBTQ health program, the aims of having these LGBTQ plus veteran care coordinators are to provide affirming and knowledgeable care, create an affirming environment, so not just an accepting environment, but an affirming environment, to educate and train employees, and then to do internal and external outreaches. And so, as I said, I was one of the LGBTQ plus veteran care coordinators at the Hampton VA. And so this is just an example of one of the booths that we had at a local Pride festival. We also put on Pride festivals at our VA. And it was always a really meaningful experience to be at a Pride festival and to have veterans be surprised and moved to see us there. And for us to be able to assure them that the VA was a welcoming place for them. Some other things that I did when I was veteran care coordinator, you can see we have displays like, what does Pride mean to you? We put up banners throughout the hospital. We flew the Pride flag in 2023, 2024. And we also did ceremonies, for instance, the Transgender Day of Remembrance. And those efforts are the same things that other LGBTQ plus veteran care coordinators were involved in throughout the nation. So now I'm going to talk about the directives that the VA has or has had regarding LGBTQ plus veterans, and let you know what things are still in effect and what things have been changed. And I know that people in the chat may have questions, and we are saving room for questions at the end of the presentation. So please continue to ask them and we will get to them as best we can. So Directive 1340 is about lesbian, gay, bisexual, and queer plus, with plus meaning anyone else who is kind of within the LGBTQ umbrella policy and care. That directive allowed protected time for LGBTQ plus veteran care coordinators. It also stated that care has to be provided in an affirming environment, regardless of sexual orientation or sexual behavior. That care is responsive to the needs of lesbian, gay, bisexual, queer plus veterans. Also ensures that providers ask about sexual orientation, because we know that there are unique health factors and mental health factors that can go along with being a lesbian, gay, bisexual, or queer veteran. And then it also prohibits attempts, either formal or informal, to convert or change a veteran's sexual orientation. So veterans cannot be told by mental health providers that maybe they should consider being straight, and they also can't be proselytized to be straight by anyone in the VA hospital, including like housekeeper, support staff, et cetera. So this directive is still in effect. However, VAs currently vary widely in terms of the amount of things that they can have that show that the VA is a safe and affirming environment. So for instance, my former VA at Hampton initially removed every banner, sign, flyer, magnet from the VA, including telling people to remove them from their offices. After I went to the national press about this, after I quit, they have restored those. But other VAs may still have none of those in sight. And at most VAs, LGBTQ plus veteran care coordinators are no longer allowed to provide any trainings. So not allowed to train staff on how to provide LGBTQ appropriate affirming care or do outreaches. So no more pride celebrations, tables at events, things like that. Some VAs, including my former VA, have removed pages with LGBTQ plus BCC contact information. Staff may or may not be sure whether they should still be asking about sexual orientation, and also employees who are Christian who feel uncomfortable by anything that's happening at the VA are allowed to report their colleagues. And so I know people who have been reported for things like showing a flyer for an LGBTQ affirming group within the context of a primary care group chat, or having a piece of office decor that says all are welcome here. So Directive 1341 was the directive that previously provided for transgender and intersex policy and care. That directive has been rescinded. The VA now no longer acknowledges trans identities and officially says that there are only two sexes, male and female, and that they are determined, well, they say at conception, but basically. And trans veterans are now supposed to be no longer assigned to rooms or services that are in alignment with their gender identities. So trans men would be placed in inpatient women facilities. Trans women would be placed in men's facilities. And that's regardless of what documents they've changed, what medical procedures they've had. Conversion therapy is not, there's nothing that says it's encouraged, but 1341 banned it, and so it's been rescinded. And there's obviously no more recognition of Transgender Day of Visibility or Transgender Day of Remembrance. And veterans are no longer allowed to start gender affirming hormone therapy at a VA facility unless they were being prescribed it through the Department of Defense or at another VA. There's also, for all transgender veterans, no more laser hair removal or electrolysis, no more access to gender affirming prosthetics, no more access to speech services for gender dysphoria. So on a positive note, mental health services for gender dysphoria, including groups, are still allowed. And within the space of an individual therapy session, therapy can be affirming and supportive, and most VA providers are still affirming and supportive. And so I mentioned groups. So the groups that we started at Hampton that are still ongoing, just to give you an example, Hampton still has an in-person LGBTQ plus resilience group, a virtual resilience group, a trauma group for LGBTQ plus veterans, and a suicide prevention group for LGBTQ plus veterans, and through our service network, a support group for transgender veterans. So there is still able to be affirming and comprehensive mental health support. So more details about gender affirming hormone therapy. So again, if you've already been prescribed hormone therapy from the DoD or from the VA, and that would include approved community care. So if you're coming from the DoD and you had a transgender care plan in place and you were getting hormones from a community provider, or if you're at the VA and you had started hormones through community care, that would count as long as it was community care that was funded and established through the VA. So approval or referral to start does not count. So I know that for folks who are coming from the DoD, you may have already gotten your transgender care plan or had an appointment with endocrinology that's been canceled. So unfortunately, unless you're at an individual VA, that might be able to bend the rules. That does not count for receiving VA care. And also being prescribed by another service that's not DoD or the VA would not count. So if you have been receiving hormones, let's say through Planned Parenthood, you would not be allowed to transfer those hormones to the VA. So with all of that said, our veteran care coordinators absolutely can still help. There is an LGBTQ plus veteran care coordinator directory, which I'm going to show you. Okay, there's a locator tool where you can find the LGBTQ plus veteran care coordinators in your state. So I will show you that some VAs have removed their contact information. So here's my former VA. Sorry, we can't find that page. That's because someone complained about it. However, any LGBTQ plus veteran care coordinator that's in your state or in your network or really in any state, they're all in touch with each other and they can refer you to the appropriate person. So let's say I tried to go to the Hampton one. I saw the page wasn't found. Maybe then I'll go to Richmond. Oh, here's the contact information for the person in Richmond. I could call or email that person and they would then put me in touch with the person for Hampton. And I'd say about 75% of those sites are still listed. But even if it isn't listed, you still should have, that person still exists. They're just not on the website. So what can an LGBTQ plus veteran care coordinator do? I'm trying to minimize my screen. Okay, so no, I didn't want this. Okay, sorry, folks. Okay, so they can provide a supportive, safe space for you and talk to you about your experiences as a service member, as a veteran. They can help connect you with affirming mental health care and with a primary care provider who's affirming. They can help you transfer if you've been receiving hormones from another VA. They can help you transfer care, or from the Department of Defense to the VA. They can refer you for PrEP, so for HIV prevention. So PrEP is still permitted. They can answer your questions about your care, and they can also tell you where in your hospital single stall unisex bathrooms are located. Because right now there is a bathroom ban in place at VA hospitals where you were supposed to use the bathroom of the sex you were assigned at birth. So if you are entering the VA and you want to know if your provider is affirming, so some questions that you can ask. So just very straightforward. Do you have experience working with LGBTQ plus veterans? How do you approach care for people with diverse sexual orientations or diverse gender identities? You can also, if you're transgender, look at your progress notes. So the VA, you can have immediate access to your progress notes through their My Healthy Vet portal and see if your provider is using your correct name and pronouns. Now, your provider might be hesitant to do that because they don't want to out you to all your other providers. So make sure if they're not that you know why. But those are some ways to see if your provider is affirming. If they're not, you can request another provider within the VA. You also can request referral to community care. So the Mission Act allows referral to community care in several circumstances. One is if you live within a certain outside of a certain drive time for the VA, or if the wait time for your VA exceeds a certain limit, and there's different limits for like primary and specialty care, or if it's a procedure or that's not available at your VA, but that the VA covers. However, it's also permitted if it's in the veteran's best medical interests. So if you are at a VA where you are where there's not affirming care being provided. So let's say you've tried working with a therapist, maybe you requested another therapist, or your primary care provider or primary care team does not seem affirming, or your providers won't honor your name or your pronouns, you can request referral to community care. But I'm just going to note that, remember, so rather than just doing this kind of as off the bat, the minute you enter the VA, if you're new to the VA, please do remember that many providers do still provide high quality affirming care and are trained in treating LGBTQ plus veterans. So and they might actually provide you in many cases with better, more trauma informed, more veteran informed care than you might get at the community. So please see what your VA feels like before you request a referral for the community. So if you do request a referral for outpatient community care, so I've put some language here. So if you want to take a photo of this, or I believe the webinar is going to be available after, yes, it's going to be available after we speak, so you can have it to refer to, but I put some language here about how to request a community care referral. And this is specific for transgender veterans, since transgender care is the care that's being affected. But again, the VA policy changes that deny recognition of transgender identities have made it unsafe for me to receive affirming care here. And my needs include psychological well-being and access to providers who respect and affirm my gender identity. So if you are transgender and you need residential care, so that could be residential care for substance abuse or for post-traumatic stress disorder, or because you're homeless, then being aware that VAs are now required to have you room with people who are with folks who are in your sex room according to your assigned sex at birth. So here is some language that you can use to request residential treatment that affirms your gender identity. And if you are transgender and you need emergency care, so the VA allows you to go, if it's an emergency, to the emergency room that's nearest to you or the emergency room of your choice. If it's important to you that emergency care staff honor your name and your pronouns, or house you according to your identified gender, then you should probably go to a non-VA ER. And make sure to let the ER know that you're a VA patient, because then they'll contact your VA and the VA will pay for your visit. If you were to go to the emergency room, so let's say you were having a mental health crisis and you went to the emergency room, they might just have you go to inpatient care at that facility. So if you think you might need inpatient care, if you are having a mental health crisis where you're afraid that you might harm yourself or someone else, I would say go to an ER that's at a hospital that has an inpatient unit that is going to house you appropriately. And that pretty much would be any inpatient unit that's not a VA at this point. And ask to be able to remain there and receive your care there. Sometimes they will attempt to transfer people to the VA. You may or may not be able to fight that. But again, you can let the staff at the hospital where you are know that you're not going to feel safe or be able to receive appropriate care if you are transferred to a VA, because you would be housed inappropriately. So if you're making these requests and they are not honored, I've also put in some language for how to request an ethics consultation. Every VA has an ethics board. It's unethical to provide anti-transgender medical and mental health care. So you can attempt to, you can request an ethics consultation and push the issue that way. And along those lines, just as a reminder, all major US professional medical and mental health organizations agree that gender affirming care is essential, is evidence-based, and should be accessible to transgender adults without discrimination or restriction. So regardless of what policies are being put in place on a national level at the VA, those policies do not reflect the consensus of major professional mental health organizations, including medical and hospital organizations who say that, unlike the VA, correct names and pronouns must be used at all times, and housing should reflect gender identity. And again, those are not optional courtesies. That's not if people feel like it. That's standards of care that prevent harm, uphold civil rights, and promote patient safety and dignity. So the VA is accredited by the Joint Commission. And when the Joint Commission comes, I've been there for a visit. It is a huge, huge deal. The Joint Commission says that staff have to use a self-identified name and pronouns, and that people should be roomed in alignment with their gender identity, and specifically says denying a trans person appropriate room placement or misgendering them can cause psychological harm and constitutes discrimination. I don't think that the VA thought about this when they decided to put these policies in place. It will be interesting to see how Joint Commission visits go. I'm also going to note that anybody can file a report with the Joint Commission. If you Google them, there are multiple options to do that. And lastly, I want to reiterate that you are not alone in your fight, that many, if not most, VA employees are allies, or many are LGBTQ plus themselves, including LGBTQ plus veterans. So even if the policies have changed, people's individual behavior and their hearts and their skills and goals have not. So I'll just show you a couple of pictures that reflect that. So any rainbow flags have been prohibited, and some hospitals have prohibited anything that looks like a rainbow. So you can see some ways that employees have gotten creative with putting rainbows in their offices, or putting books out. So the Unwrapped is about integrative therapy with gay men, putting books in their offices that signal to LGBTQ plus veterans that they are in a safe space. And one employee was reported by her office mate for having an LGBTQ plus magnet and for posting a flyer about a group. And in response, she got these tattoos. So you can see she has the rainbow on one hand and the Bi Pride flag on the other. And she said, they can't make me remove my hands. And this way my veterans can see where my heart is. So that is all that I have. I know we're going to be taking questions after Ilaria speaks, so I'm going to end the show and make space for her.
Hi, thank you. That's very informative and eye-opening, and aren't we thankful for that? It is very difficult right now to feel positivity, to feel hope. And I think it's important to recognize that we're feeling very chased, very persecuted. But there is hope. There's absolutely hope. There's positivity. And Mary ended with something that I have seen and experienced personally, which is that we are not alone. We have many allies throughout the VA system. And we're going to be quick to recognize every time that we're slighted, discriminated against, harmed, misgendered, called out, refused care, and every other horrible interaction that we can think of, it's out there. And there's going to be those instances. And there are ways to report that, and they should be reported. I encourage all of us to also seek out all of the positivities. I had a appointment recently in Martinsburg, West Virginia, which is not known as a very LGBTQ friendly place, state, or facility. And the staff there made a point of pulling me aside and letting me know that how supportive they are, how they're not agreeing with all of this, and that they are here for us. And we shared information, learned of several other veterans who are out in the wilderness and encouraged to contact. It's important for us to celebrate and recognize and support our allies. Not necessarily in ways that might call them out. Like, we don't want to send in a contact form that says, oh my gosh, Mary was so amazing. She pointed out every rainbow in her office. And, you know, no, we don't want to do that. We don't want to harm them while they support us. But it's tempting to walk into a VA right now and feel ready for battle. In fact, that's what this feels like, is that we're getting ready for battle. We're on a deployment and getting ready to go out into the wire. Or worse, that we may be attacked while we're in the safety of our base. But there are allies, and it's, while we need to have our armor up, let's let some of the good poke through as well. Be open to it. Spot it when you see it. Acknowledge it, maybe with just a smile or a knowing wink. They're there to help us. And when you see the good, share the joy, share the good. Let us know, you know, come into these networks that we have through such wonderful organizations such as Modern Military, and come and share, like, hey, this organization is a good one to go to. Go to this VA. It's as good as warning us about the ones that we should avoid. Martinsburg, West Virginia. Go there. But go and seek your joy. Recognize your joy. Have room for your joy as you gird up for battle. And we will be getting through this. We're in for a long suck. And like I said, hope is hard, but hope is achievable. And I think we're going to come out okay in the end. Just, it's going to be hard for a while, and it's going to hurt, but we've got this. Remember, we're all veterans. They trained us for this. They taught us how to fight, how to be resilient, how to outlast, how to survive. They trained us. Well, it's time to put that training to use, even if it's here seeking our own medical care. Know where you feel safe. Know where you don't feel safe. Mary mentioned in her slideshow the idea of, you know, going to an ER if you're feeling not particularly safe, going to a place that you know will take care of you better than maybe a VA that won't. Answer those questions in advance. It may not be reasonable to be, when you're in that very dark spot, to be thinking, okay, is this a good, that's not going to help. So know your questions in advance. Think about it. If I need to go somewhere, what facilities can I go to? Write it down for someone else who may come and help you, so that they know, take me here. Please don't take me there unless it's absolute last resort. These are the good facilities, take me to. Answer all these things in advance. Again, just like we're going on a training for a deployment, we train for this, we rehearse, we practice, we plan, we think about all these things, and we're good for this. Thank you.
Wow, I learned so much, Dr. Mary. I cannot wait to share with all our veterans and unwilling soon-to-be veterans, some of those resources, especially how to advocate for yourself, that you provided those ready-made scripts. That's so handy. Thank you so much for those tips. I think I learned a lot, so I appreciate it.
Thank you so much.
Do we have any questions in the Q&A?
We did have a question earlier asking if slides were going to be available or if there was a recording. And for those who joined late, yes, we are recording this for future playback. And I have a sneaking suspicion slides will be available as well.
Yes, absolutely.
That's great. I'd say now is the time. If you have questions, audience, get them into the Q&A and we will answer them. While we wait to just see if anybody does put in any questions, Mary, do you have any suggestions for our service members who are beginning to navigate the disability claim process and get enrolled in VA healthcare for the first time?
So I would say as you are, I don't have a lot of advocacy for the disability claims process because I haven't had much expertise there, but I would say as you're getting enrolled in the VA, immediately find out who your LGBTQ plus veteran care coordinator is and get in touch with that person. Even if you haven't made an appointment yet, you can talk to them on the phone. They can tell you what's available and just to know who is an automatic safe person at my VA.
And that was such good information earlier that you talked about. They might not still have the title, but you can still find them and connect to them, and they're still a safe person. That's really, really handy.
Yeah, they still have the title. They just may not have a web page.
Right.
So, but they are still assigned. You just may have to go looking for them.
We'll make sure that we keep that directory downloaded and available.
Coming to us through the questions section, Terry Womack works with a VSO, Veteran Service Organization, called Still Serving Veterans, and wants to make everyone aware that they are here to help and support. They're based out of Huntsville, Alabama, but can help anywhere. And the email, twomack, WOMACK @ssv.org. For all of our friendly veterans, that's T as in Tom, W as in whiskey, O as in Oscar, M as in Mary, A as in Apple, C as in Charlie, K as in Kilo, at SierraVictor.org.
So is the request option to be connected with the VCC still available on the VA app? I believe it is, but I don't know 100%, but it still should be. That should not have been taken down.
And I go through and search through the VA site from time to time. Searching through the VA internal search bar will not always bring up results. Like you cannot seem to possibly bring up a VA LGBTQ coordinator list using search through the VA, but outside search engines such as Google still work and still bring up the links, which are still there. So they're hidden behind curtains, but they're still there. I want to touch on something. We're definitely in this time where they're taking things from us. They're taking our healthcare. They're taking our representation, our visibility. Something for all of us to remember. They can take those things. They cannot take us. They cannot take who we are. They cannot take who we see and recognize in the mirror. They cannot take who we present ourselves to be in the world. For example, I'm not getting rid of my rainbow hair, and I proudly wear it every time I go into a VA facility. I do not put it in a cap. I do not hide it away. I will not hide who I am. Be yourselves, be your authentic selves. They would love nothing more than if we quit using the VA entirely and went away from them. But we're not, we're veterans. We earned this and we're here. So, caveat, as long as you feel safe doing so, safety is always a prime, but as long as you feel safe, comfortable doing so, be yourself, be who you are. Let them see you because they can't take that away at all.
And I know that, thank you, Valeria, for your kind of making me tear up here. But I know that, as an LGBTQ plus veteran care coordinator and also being a part of the transgender care team, through meeting open transgender service members and veterans, and that has been one way that I've seen, hearts and minds being changed also. So by being yourself, by getting to know, the front desk person at the mental health clinic who, maybe when she started that job, she didn't never think she'd met a trans person. And then she becomes good friends with one of our trans veterans, and I'll watch them, I'll walk in and they're talking, and I walk out to use the bathroom half an hour later and they're still talking. That's you, by being yourself, you are helping pave the way for every LGBTQ or trans veteran who comes behind you.
Thank you. Thank you both so much. I'm so excited. Hopefully everybody has received just great information. We will be sending out some information so that you can get in contact with us. And if you have any questions that you didn't want to ask today, there'll be an opportunity for you to ask them to us directly. So I just want to quickly go over the Resilient Heroes program. So Modern Military, we have launched a new program. We're really excited about it. What we do is we connect our veterans that are struggling, active service or veterans or families to really imperative resources within the community. We are a bridge from where you are, wherever that is in your service or retiring or separating, to just really important resources that could be financial, housing, but mainly we focus on mental health. So we really try to create a safe space for you to come to initially. So if you're struggling to just figure out how to get yourself back to where you feel stable, especially mentally, but also just kind of in some of those basic needs, we provide a safe space for you to do that at. So within our program, we provide one-on-one direct care. So you'll be meeting with me most of the time and just checking in and make sure you're okay. But we also have a great resiliency circle, a support group where our veterans and our community members can just come through to find time together to just be in community. And Ilaria is there with us, which is great. And we're also adding a lot of events so that we can also create community outside of just our support group. So as much as we understand that right now there is right now the community is just in a difficult time, we want to do all that we can to provide what we can. And so the Resilient Heroes program is a space that I think if you are having any type of mental health challenges, or if someone is having any type of mental health challenges and wants to get connected with an organization they can trust, then we do invite you to connect with us.
Such good info and so helpful. I'm just really excited to share this information to everybody. And we met a new person who can help with claims, who's going to be a friendly face for people. So that was so wonderful. So thanks everyone. And thank you, Ilaria, and thank you, Mary and Antonique, and Ashley back there doing our tech. So thanks everybody. And I hope everyone has a wonderful rest of your day. And if you need support, please reach out. We are here. Bye.